You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. So if you are unhappy with your smile, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. My first guest is an expert on the topic, Dr. Stephen Rosenstein. Dr. Rosenstein, welcome to the program.
Thank you, Randy. It's a pleasure to be here.
Now, before we get into today's topic, tell me a little bit about your practice. What kind of patients do you see? I mean, is it only cosmetic?
Oh, no. My practice is very broad-based general practice. We do a lot of cosmetic work, we do a lot of reconstructive work, and we do some basic, dentistry for people who just require.
So you still do fillings and things like that?
I still do fillings. I do root canals. I do extractions when necessary. So we do pretty much everything, and we also refer to the top specialists in the area when that's what's in the patient's best interest.
Now, we talked on the phone. Very interesting. You said I wanted a relationship-based practice. Expand on that.
Well, I want to be a part of my patient's life. I don't want them to see me just as someone they come to for a problem. That they come to me because I can help them improve their life in some way, to make their life less problematic in terms of dentistry. And to learn, and by relationship, I mean, I want to understand them. I want to take the time to know what their fears are about dentistry, what their outcomes that they desire are, and to be their dentist for their life.
Okay, we were talking, in the right before the show started, and you said that sometimes you have to threaten to tickle patients, your staff. I mean, even though you don't.
Right.
Is that so? You have some fun there?
If we're not laughing many times throughout the day, there's something wrong.
Is that right?
Oh yeah, absolutely. My assistant and I, the patients and I, my partner sometimes, we have to be laughing or something's not right. Dentistry, people have anxiety about coming to the dentist.
Yeah, do they still say that they don't like dentists?
Yes, definitely. Some people come with a lot of anxiety. Some people, we're very good at getting them over that anxiety, but not everybody. There are some people that still come. A couple of people come to mind that no matter what we try to do, they're just extremely anxious about coming to the dentist. But for the most part, that's improved a lot with the things we do in our office to help them with that.
But you say you've always been a cosmetic dentist.
I've always been focused on whatever I do in dentistry to make it look as good as it can look. So whether it's a filling in the back of the mouth or whether it's the two front teeth, cosmetic aesthetic dentistry means it should look natural, it should look real, it should look like I never touched the tooth.
Is that right? Because I feel like I could spot veneers, 20 yards away.
Well,
or at least 15 yards away.
Well, many times you can. Because they don't fit that patient's face and smile. And that's part of the difference between putting porcelain or bonding on teeth just to change the way they look and making them look real and natural.
Okay, so there's art to it.
Great deal of art.
Okay, now you brought pictures, pretty dramatic, so we'll get to those in a second. Let's talk about your background and training. I mean, after dental school, you've had a lot of training. Why don't you tell that story?
Well, after dental school, I did a general practice residency training, which is an opportunity post-dental school to get a little more experience, a little more skill in all areas of dentistry. Then I went into general practice, first in Philadelphia. And to be honest with you, I don't remember what it was that introduced me to a postgraduate training institute called the Pankey Institute down in Florida. But I got introduced to it.
You say that's a world-renowned institute?
It's a world-renowned institute. Now it's in Key Biscayne, Florida. And people from all over the world come to teach there and come to learn there. Literally all over the world. People from Japan and Australia and England and France, as well as all over the United States.
Is there that much to learn? I mean, about?
Yes, it's like any other.
It seems straightforward, though.
Well, it does seem straightforward, of course, because it seems easy if you look at Michael Jordan playing basketball. He makes it look easy.
Yeah, okay.
All right, but he practiced all his life, hours and hours, to be as good as he is. All right? And dentistry is no different, or is medicine, or law, or carpentry for that matter. If you want to be really good at what you do, you need to continue to learn and practice and advance your skills.
Who's the typical patient that's coming in now to do something about their teeth? I guess it's become very mainstream to get veneers.
Well, it
Is that
has,
right?
because,
Is that true?
yeah, it really has. People know what veneers are. They've heard it. They've seen it advertised on television and things like that. But a typical patient doesn't really exist, because everybody is unique and everybody has different reasons for how they feel about their smile and what they want to do to change it. And some people come in because they can't chew very well, but the smile is only an adjunct to that problem.
Okay.
And some people come in because, you know, they're getting married in a few weeks.
They want to look good in the pictures.
And they want to look good in pictures. They've got a big event coming up. Some people come in after they get divorced, and now they're back in the game again, and so they feel they got to look better.
So is it mostly wealthy people that you see?
Oh, absolutely not. We try very hard to not let the investment in their mouth get in the way of doing the dentistry that they want through various financing means, or giving them time, or spreading it out.
So you do it in stages.
We do it, and some of it can be done in stages, absolutely.
Now, do you come from a standpoint that you think everybody should, you know, if their smile doesn't look good, that they should get veneers or cosmetic dentistry?
Absolutely not. It's a wonderful thing to do if it matters to you.
But people say that their smile can hold them back. I mean, you
Absolutely, sure, absolutely. I have many patients who come in and say, you know, I'm having a hard time when I get into big crowds because I don't smile. And I've had some people come up to me and say, why are you so down? And I'm not down.
Okay.
They say, I'm
They're
not
perceived
down,
as being
but
serious.
they're perceived as being sullen, all right, because they're not smiling. And they're not smiling because they don't like their smile.
Now, you brought some photos. What are we looking at over there?
Yes, this is a gentleman here, Randy, who is exposed to a lot of very high-level people because of benefits and events that he goes to with his wife, who runs one of the
charity events.
Charity events, because of one of the art museums that she runs. And he was just not happy with his smile. He knew it didn't portray who he was. You know, his smile doesn't make him look very sophisticated and like he's going to be working in the environment that he works in.
So when you look at that smile, I mean, what goes on in your mind? And I mean, do you know right away this is what I'm going to do?
In this case, I did. Yes, I could tell right from the get-go.
You know, they say artists can see that end result. I mean, can you see that?
Yeah, I could see it right away.
So with him, what'd you do?
Well, we did porcelain veneers
Like how many?
on his 6 front teeth.
6,
All
okay.
right? His smile wasn't as big as some people's smiles, so we didn't show all the way back. So you do what you need to fill his smile.
You say for some people it's even hard for you as a dentist to get them to smile. That they're
Yes,
so
yes,
not used to
sometimes if
smiling.
they're not,
Is that true?
They don't have it. Yes, they don't have a smile that they're comfortable with, then they just don't smile. And so when I'm taking pictures in my office, sometimes I have to threaten them with tickling them to get them to smile. All right? And so, but it works every time. It works every time. That's the way I get the smile.
All right, with a little, a few threats of tickling. That's
Right,
good. Okay,
right.
so the after looks pretty
The
good.
after speaks for itself, really. It blends with his lips. It blends with his smile. He's got
It
a
definitely looks
confident smile.
sophisticated, as you
and
say.
He looks
He looks the part now. That
right. Let me show you this next patient. This is a
Wow.
patient whose teeth don't look so good because of the spaces for the most part. Okay. He's a physician. He'd been this way for a while. We had talked about it for a while, and he was like a man, wasn't so quick to jump in and do
Yeah.
it. And then one day he was in the office for a regular checkup, and we were talking about it again. And so he went out of the office that day. Half an hour he came back to my reception to schedule the appointment to go ahead and do it. We did 6 veneers on the front of his teeth, and the result just blew everybody away because of the huge difference.
So does he smile more too?
Yes, he does. Yes, he does. He's.
And what are the age ranges? You mentioned he retired. I don't think of someone, even though 65 is very young today.
Right.
Especially in Florida, right?
Yeah, especially.
That was a joke because we're here in
Right,
California.
I know it.
But, you know, I mean, how old are the upper end of patients that you see for veneers?
I would say into the 60s and 70s. Okay. They want to look good and feel good, and it makes them feel better.
How can teeth make you look younger? We talked about that on the telephone.
They make you look younger because you smile more, because you can change the color, which looks brighter and younger, more youthful. And the shape of the teeth can also make you look younger. Sometimes.
What do you mean?
Well, if the teeth have been worn flat on the edges, it's an older appearance.
Interesting, okay.
Than if there's like a step in.
Like 20-year-olds have a more curved.
Have a more uneven edge to their teeth. than older people who have worn their teeth down more. So that if we put little imperfections in the edges of the teeth and not make them look too flat and worn down, that looks a lot more youthful.
We're going to take a quick break. We have time for a couple more photos. What are we looking at right there?
Well, this is a lady who clearly wasn't happy with her smile. Been that way for a long time.
That's unusual. I mean, to see teeth like that. I mean, that's pretty bad.
Well, yes, it is.
You don't
I see it
that.
all the I see it all the time. But the lay person doesn't see it because these people aren't showing them. They're not smiling.
They don't smile.
They don't want to. They
Very
don't want to show you this. Well, clearly the color of her teeth is off because she has two old caps that are the original. Because porcelain color doesn't change. This was the color that was done to match her teeth.
Porcelain's made out of glass.
Porcelain is a glass.
Okay.
Yes, absolutely. And just like your porcelain sink or whatever, it doesn't change color.
So it doesn't stain, really?
It doesn't stain. No, it doesn't.
Why can't they just whiten? Why can't you just whiten those side teeth?
Well, because there's fillings up along the gum line here and erosion of the tooth from toothbrush abrasion or chemical abrasion or sucking on drinking too much Coke, can destroy the surface of the tooth. And just whitening it isn't going to change that for her. And also she's got brittle teeth. She's chipped her teeth. And the length of these teeth are off.
So with her, what do you say? I mean, what did you do?
In this case, we didn't do veneers because she had structural deficiencies in her teeth, and her bite needed to be improved with her back teeth. So we did all porcelain crowns from the.
What does that mean, by the way? Porcelain.
Porcelain crown is a full cover of the tooth.
Goes over the tooth.
Goes over the whole tooth. A veneer just goes over the front surface of the tooth.
Okay.
So that's the difference. Now we prefer
is
to do
that like
veneers.
a cap tooth? I mean, what we call
A crown is a cap tooth. So for this lady, we did full porcelain crowns.
Very nice.
All right, to correct the tooth size, the tooth color, the erosion that was there, and also to make sure that the bite was functioning for longevity.
So it's the difference. It looks very healthy, very very clean.
It is, and
compared to the other.
It also, for many people, it also stimulates them to take better care of their mouths because now they've made an investment in their selves, in their health, in their appearance, and they want it to work, and they want it to last. And part of my job to do it right is to make sure everything fits well so that it promotes the health of the gums and makes it easier for them to clean and care for their mouth in the future.
Okay, do you get certain high-profile patients, because we're not showing faces here, that they don't want anyone to know that they have veneers? Do you get some of that?
A few, yes, I do. I have a few. It's interesting because you have to serve your patient's desires. Some high-profile patients, they want their teeth to be very bright white, okay? And some prefer not. They prefer a more natural look. So that's my job, to provide them with the look that they want. With my guidance, sometimes I'll try to guide them away.
And they have a lot to say so in the process, what their teeth are going to look like.
Absolutely.
Okay, we're gonna talk about that after the break, because I have a lot of questions about the process. One more photo,
okay,
and then we'll go to the break.
All right, this gentleman came to me because he couldn't understand why he was wearing his teeth out. And this cause was erosion from acid reflux. It's a gastrointestinal problem. He was refluxing acid, and the acid dissolved away his teeth.
So what did you do for him?
For him, we did 6 veneers on the upper, and we did bonding for his lower front teeth for cost reasons.
Is that what they do? I mean, sometimes they get the top done, wait 6 months, 8 months, they come back and do the bottoms?
Absolutely.
Okay.
It may be a year or two. It all depends. But that's okay because we've got them in a stable, healthy, pleasing condition at this point that they can then proceed at their pace.
Okay, we're going to take a quick break. And we come back more about the process, how you call it smile design. Is that what you call it? What do you call it?
Sure.
Smile design?
Well, smile design is a good way of looking at it.
Okay, we'll take a quick break. More photos and the process. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, what you can expect during the veneering process. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. My first guest is Dr. Rosenstein, and he's here today to discuss what's new in cosmetic dentistry. Okay, so you have a few more photos, and I want to know about the process after that.
Okay. The first one is was a younger man in his 30s who came to me.
That's a young person.
That's a young person. This patient hated his smile. One of the things about this case, in addition to the fact that the upper teeth are hitting the top edges of the lower teeth, which has caused them to get uneven and wear. Right. The other thing that is critical to the smile here is the position of the gums. They're not symmetrical.
So they're
not
uneven.
They're uneven, which makes the teeth look missized. One front tooth looks bigger than the other,
So you can
longer
fix
than the
that.
other
You can
front
fix
tooth.
that? I mean, that's an easy one?
It's not an easy one, but it can be fixed.
All right. So the after?
The after is dramatic, I think.
Yeah.
The gums are all symmetrical
So the
now.
upper gum line now matches.
The gums match. The tooth sizes are symmetrical and even with each other.
And he's happy.
He's very happy. The next case was an older gentleman who just had beaten the heck out of his
Wow.
teeth. As he wore out his teeth, they actually moved down. And so here again, the gum line is out of place. But not only is the gum line out of place and the teeth short, these teeth, you can't tell from this picture, but these teeth are actually angled backwards toward his tongue.
So he doesn't smile. I mean, this is a person that just literally
He really doesn't smile very much. And even if he smiled, because his teeth are so short, he couldn't show them. We had to take that into consideration as we were planning, because this was not just planning his front teeth. We had to also take into consideration his bite and his back teeth in order to make the room necessary to make his front teeth longer so it would look better.
Now, I know this is a big topic because, and you tried to help me understand it, but that if they come in with short teeth from grinding or whatever, that if you don't adjust the bite, if I get this correctly, that those veneers will pop off or chip off.
If the bite,
that's a big topic, I guess, this bite.
That's a big topic. The bite is a big part of the longevity of what we do.
And this is something taught after dental school. I mean, most of what you've learned, would you say, is after dental school when it comes to all
well,
these
I've
bite
been out of
issues?
dental school for a long time, so
Right.
yes. And I'd like to continue learning. So yeah, I've spent a lot more time learning after dental school than dental school's 4 years.
Okay.
I've been out
Next
of
time you could just say, Randy, that was a ridiculous question.
Okay, all right.
Okay, we'll make it. No, I'm kidding around. Okay, so next one is, so for him, it's porcelain veneers?
No, for him, we needed to restore both the tongue side and the cheek side of his teeth. So these were full porcelain crowns. And on the lower, we actually had to do a little gum surgery to lower the gum position to make the teeth look longer.
Okay.
So that we ended up with a more pleasing result.
Very
In the
nice.
upper, we did orthodontics. We didn't have to do gum surgery on the upper because we moved the teeth and the gums orthodontically to give me the room I needed to restore his teeth.
Okay, now the process. Okay, so somebody, for the sake of time, somebody walks in, they don't like their smile for whatever reason.
Okay.
What happens on day one?
Day one, we sit and talk, and I listen. I want to hear what the patient's concerns are, what they'd like for an outcome. We may take some photographs and look at the photographs together.
Do they know what they want now? I mean, people come in and they say, this is what I want, doctor? Or?
Some people do. Some people aren't sure. They just know they don't like what they have, some of them, and they're asking me for what I think can be done to make them look better. All right. But some people come in with pictures out of magazines and say, I want to look like this.
All right.
All right. I want to look like her.
They ever bring in a picture of me?
Sorry, Randy. Nobody's done that yet. But maybe someday.
I'm kidding. Okay, so they do that,
Right.
and then what?
Right.
happens?
Then if they choose to proceed, they get a chance to choose whether they're comfortable with our office. All right. And if they do and they choose to proceed, then we have to take the necessary records and evaluation, like diagnostic tests you would go to from a physician. For dentistry, we have to take x-rays, we have to
do they
take
get to see their
photographs.
teeth though first? Do you show them a smile catalog? How do you decide what these teeth are going to look like?
We can begin by looking at pictures of other smiles and get a sense of what they like, but usually I find that it's better to do it for them in their mouth. And so we make models of their teeth as they are, and then I prepare in my laboratory in wax a replica of what I'd like
And they can
to
snap it
create.
on?
Then I duplicate that wax record and then take it to their mouth in a tooth-colored acrylic and put it over their existing teeth so they can see it in their mouth.
When they see themselves for the first time in the mirror, even with this temporary that
Right.
you're talking about, do you ever get tears or they're emotional?
Some people get very excited and happy. Tears I've never had. Okay? All right. I can't say I've ever had tears. But they do. Some of them get excited. And some of them, believe it or not, some people are not sure that they like what they see when we first do it. And that's good, because it means they've got a sense of what they want. And so that's when
make
we
the changes.
Right. That's when we make changes. We start to pick apart the beginning point of where I started creating their new smile. This tooth should be a little rounder. This tooth should be a little shorter.
So when I hear this, the problem with veneers, and knowing you were coming in, we asked some people, the problem with the veneers, they're so big and they're so bulky. You're saying that that's in the hands of the dentist.
The dentist, yes, it's in the hands of the dentist with the support from his laboratory, which is the important, or very important part of the artistic side of making them look real.
Making it look real. So once they've picked it, they have the temporary, what do you call it by that? This snap-on?
A mock-up, I call it.
A mock-up, okay.
It's a mock-up.
Then what happens? Okay, they say, I'm ready to go.
Okay, well then we have to schedule an appointment for them to come in to prepare the teeth in order to receive the veneers, and they get another set of temporaries, and we make a model of what we've done to their teeth in preparation for the veneers.
So the second set of temporaries, they can eat with those.
Yes, they have to be a little careful. They're not as stable as the final veneers will be because we have to be able to get them off. Right. So we can't put them on too strong. Okay.
So ideally, if they don't have to go through orthodontics or whatever,
right.
I mean, somebody watching this, they hate their smile.
Right.
They come in, they go through this. I mean, within a month,
two
they're
visits.
in veneers.
Within a month, 2 visits can be done in 2 visits.
So they come back, you put the actual veneers on,
right?
And they're
done.
They're
they can go eat steak that night.
Is that right?
Yeah, absolutely. Once they're bonded in place, the bonding process is cured. It's over. It's done with. It's as hard and stable as it's going to get.
Is this a painful process? Do they complain about?
No, it's not painful. We do use anesthesia, local anesthetic, just because we're working around the gum, and I don't want them to be uncomfortable.
Why do you like this so much? The cosmetic aspect.
Because it makes people happy. Nobody's happy about having a filling done, but people are always happy to have their smile enhanced. All right.
Is that right?
And so, yeah, I love it. I love when the people walk out of the office and they just can't get their lips together anymore because they're smiling so much.
Really, that happens?
And they come to the front desk and they want to show Amy at the front desk what their smile looks like, and it's just really.
So you believe you're changing people's lives? I mean, you say
to the degree that their
smile
is and their self-esteem it changes their life. Absolutely, absolutely. It's fun to see them come back. They can come back at a subsequent appointment and say, "Oh, my friends think my smile is so great," or they say, "You look different. You look better. What did you do?" They won't necessarily say you did your teeth. All right. Now, if we made them really bright because that's what the patient wanted, they may notice that they're the teeth. But if the patient is willing to have them be really natural, okay, then the friends may not notice that they did something different.
So do they get compliments on their smile? I mean, for the first time?
Oh, absolutely.
Ever?
All the time. All the time. And when they come back and they tell you those stories, that's
when did you know you wanted to be a dentist?
When I was young, when I was going through orthodontics, actually, as a youngster.
You said, I want to do this.
I really went into dentistry expecting to be an orthodontist. But when I got into dental school and I started working with restorative dentistry and cosmetics wasn't quite as big a thing in those days because we didn't have the materials and the techniques to do what we do today when I was in dental school.
Well, it sounds like what you're doing is more fun. I mean,
it's a lot more fun.
Final message, and we're out of time. Somebody watching this, okay, they don't like their smile. What should they look for in a cosmetic dentist, in your opinion?
Well, first they need to look for somebody who enjoys what they're doing and is focused on the patient and the patient's desired outcome, right? You also want to make sure that that person is staying current with the current technologies in dentistry as to how to do the processes correctly and effectively.
So have you taken like 100 hours?
More.
On maybe even 1,000 hours when it comes to creating a natural looking smile?
Absolutely.
Because I talked to a dentist on the phone, and this is absolutely true, that said, I said, where'd you learn cosmetic dentistry? And he said he watched the DVD one time. And he said he was very good at duplicating what he can see.
Uh-huh. Well, we all can only do what we know and learn. And if you don't know more, then you can't do more.
So ask them their training? Because I would feel uncomfortable asking.
Well, if you're not, you shouldn't be uncomfortable asking their training. You might ask, what was the last cosmetic course you took?
Interesting.
When was it?
Good question.
When was it? Because if it was 2 years ago, that says something. If it was 6 months ago or 9 months ago, then they're probably staying pretty current. And that's one of the things you want to know.
Okay.
And are they listening to you? I'll give you one more story.
All right.
All right. I had a patient come to me, and we were talking about her case, and I said to her as we were talking, I said, when the crowns come back from the lab or the veneers come back from the lab, that doesn't mean we're done just because they came back. We have to be happy, both of us, when they come back from and she said to me, you know, no dentist ever said that to me before. The crowns came back, they put them in my mouth, and then they told me I was done, and that was it. That's not what you want from a dentist who's going to do cosmetic work for you, because it's not cut and dry.
All right. Well, thank you for coming on. Very, very good message. Now, you meet with somebody calls you, you always do the consult one-on-one?
Yes.
With the patient?
Yes.
All right.
Absolutely. Talk to my receptionist and set up an appointment to come in and just have a conversation about what your needs are and get to know our office.
Okay, great. I want to thank you for coming on. Very
My
interesting.
pleasure.
Very
My
good.
pleasure.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.